Let's talk endometriosis. Mary Bledsoe remembers thinking, this can't be the normal. Her periods had taken on a kind of life of their own. She would bleed not just 3 or 4 days, but 7 days. Her sanitary napkins needed to be changed every 2 hours. She would layer them together, two pairs sleeves, to make a kind of adult diaper. Even then, it wasn't enough. She stopped wearing white. Before she went to sleep, she would set her alarm for 3:30 a.m. so that she could get up and change her pads, but her mattress got stained too many times anyway that she took to sleeping on a plastic sheet. And there was a debilitating pain. She had headaches and joint aches that got progressively worse and left her unable to function. Yet the first time she went to a doctor, he told that her flow was regular and sent her home. It would be a long time before she returned to the gynecologist, and several years before she had a name for her condition, endometriosis. A misunderstood condition. When we meet Dr. Himani Malikoda, a consultant obstetrician and gynecologist, she had confidently just seen a patient who has endometriosis. In this young girl, the condition has manifested differently. Blood has filled her ovaries, turning them into small balloons. Dr. Malikoda, the patient came looking for help, and after she fainted 3 times from the pain and utter exhaustion. This is one of the most difficult and challenging conditions for us to treat, Dr. Malikoda says frankly. She points out that symptoms can vary dramatically and the causes of endometriosis aren't fully understood. What is known is that the gynecological condition occurs when tissue similar to the lining of the womb is found in other areas of the body, including the ovaries, fallopian tubes, pelvis, the bowel, vagina, and intestines. During women's menstruation cycle, her body releases hormones that makes the lining of the uterus thicker. If she does not become pregnant, this lining falls away, and along with the blood, it ushers out throughout the vagina. In women with endometriosis, the cells from the womb that are now outside will also swell and then fall away. In the process, they can damage organs they are in contact with, cause internal bleeding, and leave behind scarring. In some cases, they cause organs to stick together, creating all kinds of complications which would require serious surgery. There is no known cure for the condition, says Dr. Mulikoda, but helping women stay largely period free can help ease the symptoms. However, many patients do not even realize that they have the conditions in the first place. As a young girl growing up in Colombo, Sulakshana Pereira didn't realize she was experiencing something out of the ordinary. I would try to hold up, but I was completely exhausted, and there were days I couldn't stand. My legs would hurt and my hips too, as if someone had whacked me with a ton of bricks. By the time she got to university, the pain had become so much worse. Her friends and family, though symptomatic, thought she was only going through what all women go through, What was all the fuss about? There were these days when I just could not get out of a bed. I could be crying in pain and throwing up, she remembers, adding that these extreme symptoms finally got her to a doctor and she should have had a scan. But the consultant suggested she do a blood test. The result didn't seem particularly serious, and Susulakshana's experience was brushed aside. She was told it might be a muscle, and she was told it must be a muscle tissue or muscle issue. Tube handles would take care of it, but they didn't explain why the pain coincides with her periods every month and the pain itself simply just wouldn't go. The question for the fertility. When the Sulakshanas finally got a diagnosis of endometriosis, it came with some bad news. One of her ovaries had been irreversibly damaged and it could affect her chances of having a child. The first consultant she saw wanted this young woman to immediately marry and have a child. So Lakshana was aghast, and it was not that she was against either marriage or children in a principle, but it seemed like an absurd reason to tie the knot. She found another consultant who prescribed birth control tablets. So Lakshana found that taking it regularly reduces symptoms dramatically. But as a single woman, buying the pill wasn't always easy. At the counter, judgmental pharmacists would sometimes refuse to sell it to her. At some, she remembers a close relative telling her dismissively that she should be worried about the putting on weight and should get off birth control. So Lakshana burst into tears of pure frustration. I was in so much pain, she told her aunt. This is the only thing that helps. Thanks so much experience. So Lakshana seldom spoke of her conditions. Meanwhile, Prey too being given the advice not to discuss her diagnosis with anyone. Since endometriosis is known to the impact fertility, she was told it was the best she hide it from everyone. However, her husband proved to be her most faithful champion and went to every doctor's visit with her. After trying for many months, they had their first child and then a second. It took a while and the waiting felt horrible. Recalls vary. Adding, women are told that we are these vessels that are meant to carry children, and that is there if something wrong in our bodies, and it is our fault, and we are to blame. It's very unfair. If doctors sometimes did not take women's complaints of pains and bleeding seriously, leaving people to move from one consultant to the next, always to pain and trying to hide their conditions from people around them. This is particularly true for the women of marriageable age in Sri Lanka, says Ray. I feel guilty, she admits. I have these two beautiful children, and so now I am able to be more open about it. I don't know if I would have spoken out if we didn't already have a family. In the years since the birth of her daughter, Ray has become increasingly vocal, convicts, and the woman should be able to have a frank discussions about something that affects them so deeply. Dr. Maligoda agrees. She's seen women who spend the entire month in pain or completely debilitating by the conditions, and says it's critical not only that people seek help if they suspect something is wrong, but also that they stay on a treatment regimen, taking the time to really understand what is happening with their bodies. Surgery is not inevitable, she emphasizes. She emphasized, however, neglecting the conditions cannot only devastate women's health, it can also result in deep depression and stress. For her part, Ray thinks women should talk to each other more. Posts on her Facebook page in which she is honest and open about the conditions have inspired a strong response. I don't look saying, she writes. So there is a constant misconceptions even amongst the family friends that it can't be the bad. For every woman who posts a comment in response, another three sends her a private message in an indication of how many women are struggling to cope to secret. Ray says she hopes to see the stigma lessen. After all, discussing menstruation should be tobacco or distasteful. When we treat it as such, it becomes harder for women to seek the help they needed. And we shouldn't be afraid to talk about our bodies, our periods, or being ill, says Ray.